If your knees make a cracking or popping sound, don't panic immediately. Not every sound coming from your knee means damage. Let's separate harmless noise from a real problem. Try this simple test. Slowly squat down and stand back up. If you hear a crack but the movement feels smooth and completely pain-free, you can ignore it. The sound is usually due to cavitation, tiny gas bubbles shifting inside the joint fluid. It's a very common and completely normal phenomenon. But here is the danger sign you should watch for. If the cracking sound comes with pain, swelling, or a feeling that something is catching or locking inside the knee, then it may indicate cartilage irritation, meniscus problems, or early joint damage. That is when the knee should be evaluated by an orthopedic specialist. Even when the sound is painless, it is important to maintain proper knee tracking and stability. Exercises like straight leg raises help strengthen the quadriceps, and clamshells strengthen the glute muscles, which stabilize the hip and knee alignment. Strong surrounding muscles keep the knee joint centered and reduce the unnecessary stress and friction inside the joint. So remember, don't let harmless sounds scare you away from your activity, but never ignore pain in your knee. I'm Dr. Yogesh Sisodia, sports orthopedic surgeon. Follow this page to learn more about the knee and shoulder health, and if your knee symptoms persist, consult us for a proper evaluation.